This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. Numbers have a certain reliability. A football field is always 100 yards, and an episode of 60 Minutes with commercials is always 60 minutes. But in Missouri's criminal justice system, numbers related to time can be flexible. For instance, there are currently more than 400 Missourians waiting for something called competency restoration. It's a process that triggers when a judge finds a defendant not competent to stand trial. It's supposed to result in that person getting psychiatric treatment because once deemed competent, the defendant can stand trial for their alleged crimes. But for the vast majority of those 400 plus people awaiting treatment, the clock has stopped. There's no treatment space available in Missouri, so they're kept in jail waiting. And according to a recent investigation, at least 12 Missourians have been held waiting in jail for longer than even the maximum possible punishment for crimes they've been charged with but not convicted of committing. To talk about why Missouri is failing to provide this psychiatric treatment, I'm joined by the journalist behind that report, Missouri Independent reporter Clara Bates. Clara, welcome back to the show.
Thanks for having me.
Also with us is attorney and social worker Annie Legomsky. She works directly with clients going through the competency restoration process. She also runs the Public Defender System's Holistic Defense Services program. Annie, welcome to St. Louis on the Air.
Thanks for having me.
So, Clara, let's begin with you. Your recent piece in the Missouri Independent found that people who are found incompetent to stand trial are waiting an average of 14 months for mental health treatment. So talk with us about this process of competency restoration. How is it that folks wind up in this situation?
Right. As you mentioned, there are individuals who've been found incompetent to stand trial, so their case is sort of put on pause while they wait for treatment. The problem is that the state doesn't have enough inpatient beds to move them over to treatment quickly, and so now, as you said, it's an average of 14 months. I heard from the sheriff in Greene County, Sheriff Arnott, that there's a woman who's been there for a year and a half, even though had she been convicted of the misdemeanor she was charged with, the maximum sentence would have been a year. And it's challenging for jails to handle these kind of patients as well. They're not necessarily equipped to provide mental health care for over a year to these individuals.
Mm-hmm. Now, Annie, can you help us understand how it is that this can be the case, that someone can be held for that long, even longer than what a maximum sentence would be?
There's no good explanation for it. It's a problem, but what's happening, and it's happening across the country, but specifically, of course, we're always worried about it in Missouri, where it's happening case after case after case. More and more people are entering the criminal legal system with mental health issues. And so especially after the COVID-19 pandemic, we're seeing more of that coming, cases coming to us that really are just mental health issues. And then these folks, because there's no space in the Department of Mental Health for them to get their treatment, sit for a very long time in the jail, getting worse and worse in many cases.
What are the conditions that they face as they wait for treatment? And this is something that you know because you represent clients who are in this process of competency restorations, right?
Yes, and the conditions are awful. I mean, the jail is not a therapeutic environment. Everyone, I think, can agree on that. And then you're looking at these folks who are especially vulnerable, who we know are having severe mental illness and symptoms. And so what happens is, because the jails aren't set up to take care of them, they end up in conditions that are worse than you would imagine, often ending up in solitary confinement or isolation, not getting out of their cell, but for 1 hour a day maximum, sometimes never. They end up having issues that go on with their physical health because they're not getting treatment while they're waiting in the jail oftentimes. Their physical health also deteriorates. Their mental health worsens, delusions, not eating food because you're paranoid that it's being poisoned, not using the toilets. We have clients who've had feces smeared on the wall, not being able to use the toilet, having suicidal ideation, terrible things.
Now, Clara, you had mentioned the Greene County Sheriff, And sheriffs in charge of these jails where people are being held are expressing their own concern. What is it that they have been saying about having to keep people who clearly need psychiatric intervention in their jails?
I think it's been a real challenge, and this has been a topic at the legislature for several years, and sheriffs have been one of the most vocal groups saying that this isn't a process that they're really equipped to help with, and that the Department of Mental Health should be doing more to move people more quickly into treatment. Sheriff Arnott called it absolutely an injustice that people are there for longer than their maximum sentences, and has seen the Department of Mental Health as being a little bit too slow to try to remedy this issue. Because as Annie was mentioning, jail administrators, staff at jails don't necessarily know how to deal with situations like patients like that who are in solitary confinement for so long and just deteriorating for months on end. I don't think anyone involved thinks that it's going well. So the challenge is just, for the legislature and others to kind of come up with policies to make the wait list go down.
Clara, you've been reporting on this issue for some time, and in late 2023, your first reporting on it found that 260 Missourians were waiting an average of 14 months, and those numbers have gone way up. As I noted earlier, the average wait time is now 14 months. We're talking about a year and 2 months, and there are now over 400 people. Why is it that this problem is getting worse, especially if you have folks like sheriffs raising concerns about the conditions that they're seeing?
I think some of the solutions that were put in place in the 2023 legislative session have just been a little bit slow to get off the ground. The legislature appropriated $2.5 million to try to bring treatment to jails in a pilot program for 5 counties. And when I checked back in on how that program was working last week, they told me that only 1 county has an active jail-based competency restoration program going. Only 3 people are in it. And so there have been a number of challenges. And I think when I spoke to lawmakers, they were surprised that the problem hasn't gotten better since it was such a big topic in 2023 and they devoted all this money to it. They're also building a new psychiatric hospital in Kansas City, but that won't be completed until 2028 or 2029. And so it seems like the solutions might be sort of far off, or at least that's what the department says.
And Annie, from your perspective, why is this problem getting worse? I mean, back in 2013, August of 2013, there were only 10 people in this position. I mean, how did we get to over 400?
I think the mental health crisis in this country has exploded over those years, and we weren't set up to deal with it. And like Clara mentioned, there were some good changes in the 2023 legislative session, but they just haven't been implemented yet. One of those is for community-based restoration, and we think that's a huge benefit and something that we could absolutely jump on. And when Clara mentioned, the hospital and building beds, that'll be a 300-bed hospital, which is less than what the current wait list is now, which we know is only going to keep growing and growing and growing. We have to really think about, why are people with mental health conditions ending up in the jail system in the first place? Can we divert them and get them to care? And then once they do enter the criminal legal system, what can we do to avoid going down the competence path? If we can get people out of the traumatic jail environment, get them out on bond and getting psychiatric medication, the vast majority of them are going to get better very quickly. So we have to divert as well as use the new options that are available to us.
And what are the range of crimes or offenses that these folks are committing to get them into this position?
Thanks for asking that, because I think there's a lot of common misperceptions out there that people in the criminal legal system are there mostly on violent crimes, and that's what you hear about often in the news. But the vast majority of folks in these situations are charged with low-level cases. All those 12 cases you mentioned earlier where people are sitting longer than the maximum are misdemeanor cases. But I would estimate about 2/3 of the folks on the competence wait list specifically are charged charged with lower level felony cases, which makes them eligible under the statutory changes from 2023 for restoration to happen in the community, basically meaning they get outpatient treatment instead of hospitalization.
Right. What are the benefits of community-based restoration?
That eliminates them from the wait list, first of all. So it's a direct impact on the wait list. You're not waiting to go to the hospital anymore if you're out in the community. It's much less expensive for the state. The cost of hospitalization in a forensic hospital, I've seen national estimates of that at around $1,000 a day. If someone's on bond and they're getting community-based treatment, it's very low cost. And then, of course, our folks are not sitting in the jail suffering for months or years just to start treatment, getting disconnected from their family, and not even being able to get into resources or treatment. There are barriers once you're in the jail on getting intakes done with care providers, getting into housing providers, things like that.
I mean, this treatment, too, what does the treatment entail?
The crux of it is psychiatric medication. There's therapeutic elements, psychosocial therapy, and according to DMH's own website, having a supportive therapeutic environment to be in and having community support is a key ingredient of competence restoration. When people do go to the hospital, they also sometimes will put them through these classes where they teach them things like the role of the defense attorney, the role of the judge, what's the range of punishment they're facing. But the vast majority of people, if they can get on medication and get stable, will be much better soon.
Clara, it seems that this problem is only going to get worse, reading the investigation that was just published. And this is not merely a speculation or, some statement that is being put out by a government watchdog. It's actually the position of the director of Missouri's Department of Mental Health, Valerie Hune. And she had said last year that none of the solutions the government is working on will work quickly. Hune referenced this backlog of hundreds of Missourians waiting in jail, which at that time was not more than 400, it was around 300. And Hune said, quote, "It's probably going to be 1,000 individuals long before we are at 100 individuals." So where does that leave this problem, Clara?
I think the lawmakers I spoke to were troubled by this development and said that they want to return to it this legislative session. That might be through legislation, through the budget process. I think the Department of Mental Health is still working through the governor's recommendations for their budget from yesterday. So I'm hoping to hear soon what their priorities will be for the session. Last year, I know the judiciary requested money for more diversion programs, like Annie mentioned, to avoid having people go to jail in the first place and get substance treatment or behavioral treatment instead. And the governor didn't recommend that last year. So we're waiting to see what DMH is really going to ask for this legislative session to try to improve the situation. But they have said nothing will work quickly and it will continue to get worse. So we'll have to see what happens. In other states with similar wait times, there have been big lawsuits that have been successful. We haven't seen anything filed like that yet in Missouri, but that's also kind of an open question.
To what extent is this an issue that people will work on in a bipartisan manner? Annie, what is your sense of that?
It's an interesting issue because it actually brings us together with a lot of unlikely allies. Like Clara was talking to Sheriff Arnott in Greene County. The defense is not always on the same page as the law enforcement, as the prosecution, as the courts, but we're all on the same page here in that these are vulnerable people with mental health issues that shouldn't be sitting in the jail getting worse and worse and worse. So it really is a bipartisan issue. Our Holistic Defense Services unit at the Public Defender does a lot of work for our clients who have behavioral health and mental health issues. And we're working with Department of Mental Health. We're working with Supreme Court task forces. We work with the counties who are footing the bill for a lot of these folks sitting in the jail forever to come with solutions. And so we think if there are more resources, our staff, our holistic defense staff, work with community behavioral health liaisons and community providers to try and get these folks treatment plans and home plans so they can safely get out of the jail and into the community. And So more resources for things like that are things that all of our groups are really looking for and collaborating on.
Mm-hmm. And in our last minute or so, Annie, is there an example that you can provide without, violating anybody's privacy? I mean, what are the stakes of not getting to take care of this soon?
We have clients who become much worse once they're incarcerated. We have a client who was brought in who was definitely experiencing mental health symptoms, but was functional, taking care of herself, living on her own. After a year of this, she spent over 400 days in solitary confinement and is no longer talking to anyone or responding. We've had clients become catatonic from this. It's irreversible sometimes, the damage.
Annie Legomsky is an attorney and social worker who directly serves clients going through the competency restoration process, and Clara Bates is a reporter with the Missouri Independent. Clara and Annie, thank you so much for joining us today.
Thank you.
Thanks.
You can read Clara's story titled Missourians Waiting in Jail for Court-Ordered Mental Health Care Reaches All-Time High later on our website. That's stlonair.show.
This episode was produced by Danny Wissentowski.
Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.